Tell me about your symptoms before the surgery.
Well, before surgery, I had some back problems with my muscles in the back. They were always tight and sore. I had trouble walking, pain down my legs. And went to physical therapy for it, did some help, but it didn't help much at all.
Mm-hmm.
And then my foot would always feel like it was on fire, like really hot, burning the bottom of my foot.
Okay.
Couldn't get to sleep unless I had an ice pack on it.
1 to 10, what number would you give that pain bottom of your
That
foot?
was about a 9. 8 or
9.
9
Wow.
of pain level.
Yeah.
It was pretty, very uncomfortable. I just
Yeah.
could not sleep.
Yeah. May I ask you, how was his daily activities when you observed him to do before the surgery? How was his daily activity? What could he do? What could he not do?
Oh boy. It was more at night. During the day he seemed to be okay, moving around and stuff, but it was more at night that it was more the issues.
How was walking
Right now or then?
then, before the surgery?
Before, walking was not good
I
for
had
you.
a lot of therapy to go through to get better
Yeah.
walking. I had a hard time walking sometimes.
Yeah.
The back legs were hurting a lot.
Yeah. Now, our surgery wasn't that long ago. It was actually 3 weeks ago.
3 weeks ago today.
Weeks.
And we did that surgery actually in a surgery center. Your surgery was literally 28 minutes from skin to skin. And 2 hours after the surgery, you left the hospital. We lost about 1/10 of that cup of what you have there. Blood. That's all blood we lost. That's all.
Wow, amazing.
Yeah.
Wow.
And how is the pain you had in the bottom of your foot? How is that?
That pain on the bottom foot is gone.
When did that go away?
Right after surgery.
Yeah.
It's not there anymore.
Right
I never
after
had the ice pack since surgery on my
Okay.
foot to go to sleep.
Yeah. And you said as well that, you notice every day something different. Tell me, what did you mean by that?
Well, for instance, yesterday he couldn't even stand on his left leg at all, like just one-legged.
Mm-hmm.
And today he could.
So,
All of a
3 weeks out, yeah.
Yeah, it's just the nerve pain. Some days he's getting more nerve pain, some days he's not.
Mm-hmm.
And I tried telling him that, because I've had multiple surgeries, that it takes time.
Yeah.
It takes time. The
But-
nerves have to grow back.
Yeah,
the
3
nerves-
weeks is no time. For
Yeah.
spine, 3 weeks is no time.
right.
Now, and you didn't have a regular surgery. You had what we call grade 2 OLLIF S1 spondylolisthesis, meaning that your spine was slipping forward. And we did a surgery to literally put a spacer in. And these are the screws that we put in. And this is the spacer right there. And these are screws. And because your spine was falling so far forward, your surgery was a difficult case. And after the surgery, even though but on the bottom of the foot the symptoms were gone, now you have some symptoms on top of the left foot.
Yeah,
That is from me pushing the nerve to the side.
that's the cleaning of the nerves.
Yeah,
Oh.
that is the now opening up the nerve. Now, tell me about that symptom that you have on the top of the left foot. You said it comes and goes depending on the activity.
Yeah,
What did you mean by that?
if I'm just sitting down,
Mm-hmm.
my foot would just hurt. And for me to
What number would you give that?
that'd be about a 6.
6, but it's not all the time.
No.
Okay.
And to really get rid of it quickly is to stand up
Mm-hmm.
or just step on my foot.
Yeah.
Get rid of that. It's reversive.
Yeah.
Push down on it.
Yeah.
Just bend my toes up or
Yeah.
stand up. And
Usually, we say to our patient that symptoms usually they can even get worse for the first few days after the surgery, but then they plateau. Usually 4 to 8 weeks after the surgery, they start getting better.
Okay.
Usually, that's how long it needs for that to get better, and they have a very good prognosis. Only one patient in 303 patients after a year still had symptoms relating to that. So 0.3%, very low.
yeah.
Okay, but most of the time, though, before the pain get better, patient telling me that they have like a zinger, like a jolt going down in that area. That is no different than when you sleep on your arm. When you wake up, first your arm is limp, but before it becomes normal, you have like a small little jolt going to the fingers and so on. Very
Yes.
similar.
Yes.
You told me you already have some of that, right?
Yeah, so some were just
So
jolts,
that's meaning those
They're
nerves
just
is like
sharp
waking
pain.
up. Yeah,
and then it goes
it's
away.
a good sign.
Yeah.
It's a good sign. That means the nerve is coming back. The prognosis is very good. Now, what do you notice about his walking now?
I'm kind of concerned about the way he walks because
Mhm.
he's still walking like he used to, and I'm trying to tell him that he needs to straighten his walk.
Yeah,
And I said physical therapy will help with that,
absolutely.
Mhm.
but I'm like, I've been through this myself, not with back pain or back surgery, but with my knees. And I'm like, heel to toe, slow it down,
Yeah, but
slow it down, and he
Yeah.
won't listen to me.
Yeah.
And he's just
he has,
trying to move faster.
yeah, he has been walking not in a regular way for so long
Right.
that now that has to be partially retrained. But that's
Yes.
what the physical therapy. Right now, you need physical therapy more than you need me.
Yes.
So we will
Yep.
send you there, and they don't tell you what to do. They show it to you. They practice it with you. They do a one-to-one exercise, and that's part of our routine. Okay.
Yes.
So I'm very optimistic that we'll get you where you need to be, not in a year, but within few weeks. Okay.
Yep.
Yes.
You just
Yeah.
have to be careful not to overstress it. You are asking me about going back to work. You know, I see that often, but not many spine surgeons see our patient are asking them, can I go back to work?
Yeah.
Can I go back to work? Because they don't feel like that.
Yeah.
Yeah.
Even months after, they don't feel like that. My patient, though, they are pushing me to send them back to work, which is a good thing,
Right.
within
Yes.
reason. Okay?
Yes.
Okay. Well, any other question, or comment, or anything you want to say?
No.
I just need to stand up and sit down. Stand up, sit down.
Sounds
Yeah,
good to
no.
me. Good start there.
Helps back feel better and the legs.
Thank you. Thank you.